Hi and welcome back to another video of Medic Notes. This video will be on Bell's palsy, which is also known as idiopathic facial nerve palsy. Facial nerve is the 7th cranial nerve, and total there are 12 cranial nerves. So it is a condition that causes sudden weakness in the muscles on one side of the face, can be left side or right side, and it can occur at any age. The clinical features are a sudden onset of complete unilateral facial weakness. Unilateral means one side weakness of the face. Ipsilateral numbness or pain around the ear. Ipsilateral means same side with the side of the facial weakness. Reduce in taste, which is also called as ageusia. Hypersensitivity to sounds due to stapedius palsy. And also on examination, the patient will be unable to wrinkle their forehead, which will confirm a lower motor neuron lesion. You can see I've highlighted in red over here. So this is a way to differentiate between upper motor neuron or lower motor neuron lesion. So Bell's palsy is due to a lesion in the lower motor neuron. Other clinical features include unilateral sagging of the mouth, drooling of saliva, food trapped between the gum and the cheek, which may be complained by the patient, difficulty in speech, or failure of the eye closure due to facial nerve palsy may cause a watery or dry eye. Can also cause ectropion, which is turning out of the lower eyelid. Injury from foreign bodies or can also cause conjunctivitis due to failure of eye closure and also due to dry eyes. These are some of the other possible causes of facial nerve palsy. So besides idiopathic, where there is unknown cause, we should also think of these causes, especially if there are rashes or there are bilateral symptoms, any upper motor neuron signs, involvement of other cranial nerves, or even limb weakness. So it can be due to infection, such as in Ramsay-Hunt syndrome, which I will explain more in the next video, Lyme disease, meningitis, tuberculosis, or viruses such as HIV or polio. Brainstem lesions like stroke, tumor, or multiple sclerosis. Cerebellopontine angle tumors such as acoustic neuroma or meningioma. Systemic disease like diabetes, sarcoidosis, Guillain-Barré syndrome. And even local diseases such as orofacial granulomatosis, parotid tumors, otitis media, and also skull-based trauma. So these are all of the causes of 7 cranial nerve palsy. For investigation is to rule out the other possible causes. So for blood investigation, we can do ESR, glucose, Borrelia antibodies will be high in Lyme disease, and varicella zoster virus antibodies will be increased in Ramsay-Hunt syndrome. So this is to rule out other differential diagnosis. Can also do CT or MRI scan of the brain to look for space-occupying lesions, stroke, or multiple sclerosis. Lumbar puncture for CSF analysis can be done for infections, however, it is rarely done. For management, drugs such as prednisolone can be given to speed up the recovery. And studies have shown that if prednisolone is given within 72 hours of onset of the symptoms, 95% of the cases would make a full recovery, so it is important to give medication early. Eye protection due to the failure of closure of the eye, so to prevent dry eyes, we can give artificial tears or wear dark glasses. Encourage regular eyelid closure by pulling down the lid by the patient's hand, and at night we can use tape to help close the eyes. Surgery can be considered if the eye closure remains a long-term problem or there is severe ectropion. That is all for this video. Thank you.